Lexington Clinic is Central Kentucky's largest and oldest medical group with 180 plus providers in more than 30 specialties. And joining us this morning to tell us about how they use robotics for surgery is Dr. Tharun Karthikeyan. We appreciate you being here, and so many advancements in technology here with robotics over the last several years. What is so special about what we do at Lexington Clinic?
That's right, Jim. Well, here at Lexington Clinic, we're very excited to be able to use robotics to perform total knee replacements.
Total knee replacements done with robotics.
Absolutely.
So kind of how does that work for folks?
So what the robot allows us to do is to really make us as precise and accurate as possible. And the more precision and accuracy with which we can execute your knee replacement, the better you'll do as a patient.
I mean, because this is critical. This is your knee. This is how you get around. This is your walking around stuff, right?
Absolutely. This is the whole ball game in terms of mobility, about being able to participate in and enjoy life. And so these details really do matter in terms of how our patients do.
So you are there, and we're talking about robotics, but you're guiding the machine, or does it go on its own? I mean, how does this work?
It's a great question, Jim. I think it's a common misconception that the robot does the surgery rather than the surgeon. And really, that nothing could be further from the truth. I think a better way to think about robotics is it helps the surgeon to do the operation. In fact, the robot that we use is actually called a robotic surgical assistant. What the robot does is help us to make measurements of angles and spaces, and it's always the surgeon that is making all the decisions during surgery. It's always the surgeon that's holding the instruments, and the robot just helps us to perform our job better.
More precise. That's what you're looking for, because again, you know, you want to be as safe as you can, and as you said, fast recovery too, right?
Absolutely.
So if we talk about the robotics during surgery, does the robot, with you operating it from behind, I mean, again, how does that work exactly with you?
So there are many different types of robots. The one that we use at Lexington Clinic actually helps us to plan the angles of the cuts and to make the bony cuts through a targeted arm. It's still me holding the saw and running the saw to make bone cuts through that targeted arm. But because the robot is so precise, it can measure angles and degrees within fractions of a millimeter and fractions of a degree, and that's just a degree of precision that we can't achieve as human beings.
All right. I mean, we're still human. That's right. You're talking about stability there. How can someone find out more information about this if they're curious? Or, and as a matter of fact, is this better than conventional knee replacement surgery by going this route?
I think the jury is still out as to whether or not it's better in the long term. Certainly data does suggest that it can be beneficial in the short term with less pain, less inflammation, perhaps slightly faster recovery. I think this is an operation that we generally judge the success of in terms of decades, not weeks or months, and so we'll have to wait and see. But certainly it stands to reason that if we can put our components in with more accuracy and precision, that we expect long-term outcomes to improve as well.
So if someone's having, let's say, knee trouble, they're having the pains, what should they go about doing to see if this is something that they need?
Certainly the first thing, Jim, is to meet with your doctor, whether that's your primary care doctor or an orthopedic surgeon. We would usually want to establish a diagnosis of knee arthritis and discuss non-surgical options first. If you have exhausted non-surgical options, surgery may be able to help you. And as a general rule, if you're a candidate for knee replacement, you're a candidate for robotic knee replacement as well.
Excellent. Well, we appreciate you being here and informing us on all this, because, again, it happens and people need this type of surgery. Thank you so much for being here.
You're welcome. Thanks for having me.